Hi everybody, welcome to Healthline. I am Gregory Zarin. So it's a new decade, 2020. What did you look at in regards to the past 10 years, and what did you keep? What did you let go of, and what did you say thank you for? And what are your new intentions for this new decade and this new year? A lot of people, when they start the new year, they think, gosh, I'm going to lose all that extra weight and I'm going to go work out and do all these things. Well, our mission here on Healthline is to not set you up to fail, but to take steps into a healthier lifestyle. So first of all, with the word lose, why would you pick up an extra 10 pounds? Why don't you say the word, I'm going to drop that extra weight. I'm going to walk a little more. I'm going to drink more water. We want you to be as healthy and happy as you can be. And as you know, as I say, every year our mission is to share with you signs, solutions, symptoms of maladies, illnesses, and also make healthier choices. So with the new year, I'm sure a lot of us set really strong, healthy intentions to work out more, to move more, to do more, which is great. I say baby steps. If you're going to get up and run 3 miles, maybe just make it a few blocks if you haven't done it, just to get your body back into it. When we set such high standards, we can overdo it. And when we overdo it, that means we can sprain an ankle, we can fall. If we work out too hard at the gym, we can pull a muscle, we can strain something. And especially with running and being that active outside, because we've been inside through the winter, we can end up with some sprains and some tears. A common tear that a lot of people suffer throughout the entire world is an ACL tear. So what I thought is go to the best of the best and go to Adventist Health Glendale. Adventist Health Glendale Orthopedic Center, Dr. Ryan Morgan. His specialty is orthopedic surgery. How are you, doctor?
Doing well, thanks.
Thank you for being here. Happy New Year.
Oh, thanks for having me. Happy New Year.
Thank you. And a good blue suit game going on.
Yeah, you have to thank my wife.
Thank you to Mrs. Morgan. New decade. People set their standards so high out of the gate. How common is an ACL tear?
ACL tears are becoming more and more common every year, actually, as people are more active later in life, becoming more active early on. You know, a lot of times adolescents engaged in sports, just more exposure to injury. And so we're seeing the rise of ACL tears every year. And
before we head to break, do you find that most people get an ACL tear because they don't stretch prior to working out? They are pretty much stagnant, and then all of a sudden, I'm going to go run, and then without getting their body prepared, they immediately injure themselves.
Right, you definitely have to prepare yourself with proper warm-up, stretching, make sure your muscles are strong because they contribute to the stability of the knee as well, not just the ligaments.
And before we head out, what does ACL mean?
ACL is the anterior cruciate ligament, and that's the ligament right in the center of the knee. I brought a little knee model here, the kneecap removed. And ACL is right here, right in the center. Ligaments are like ropes. They connect the bones together. So the ACL connects the thigh bone or femur to the shin bone, the tibia. It prevents the shin bone from going too far forward, and it prevents too much rotation.
When we come back, we're going to talk to your little friend in just a second. So I invite you to get up, have a glass of water, do a little stretching, and we'll see you on the other side. Don't go away. Welcome back to Healthline. The conversation today is all about ACL tears, your anterior cruciate ligament. Joining us from the Orthopedic Center at Adventist Health Glendale is Dr. Ryan Morgan. Doctor, before we talk more about your little friend, share with us some of your medical history and how you ended up at Adventist Health Glendale.
Sure. So I, native Minnesotan, grew up there, went to medical school there, and then met my wife. She's from Maryland, so I went there for residency. So I was in Baltimore for 5 years training at the University of Maryland. And while there, I met a friend who had done a fellowship out here at Curlin Jobe in Los Angeles, and so was able to come out here and spend a year with those doctors and learned all about sports medicine from the best here in town. During that year, we really fell in love with it, so after practicing in Minnesota for the last 5 years, decided to move back and enjoy Southern California again.
Do you miss the hot dish?
Yeah, exactly. Missing all the tater tots.
Sure. I know, right? The conversation's all about the ACL, the anterior cruciate ligament. You brought a model with you. Can you one more time share with us where
Yeah.
the ACL is?
Right, so here is a knee model. The kneecap has been removed, so this upper
And
bone...
this is going forward, the knee
Yep,
going forward.
Yep, so this is looking
great.
right at the knee like this. This is a right knee model here. So right knee model, kneecap removed, looking at it from the front. Here's the thigh bone or femur. Here's the shin bone. That's the tibia. The little bone on the outside of the knee, that's the fibula. So there's 4 main ligaments in the knee, and the one we're talking about today is front and center here. That's the ACL. So that connects the thigh bone to the shin bone. And ligaments are like ropes. They connect bones together. And so the ACL is very important to prevent the shin bone from sliding too far forward on the thigh bone, and also prevents too much rotation. And without the ACL, you put more stress on your meniscus.
Which I've had surgery on both knees. This was in Dr. Merritt, who
Yeah.
works at, hi Dr. Merritt, at the Orthopedic Center at Glendale. This was a single and this was a double tear.
Yeah. So you have a meniscus on the inside part of your knee as well as on the outside part of the knee, so you can tear one or both, and more likely to do so without the help of an ACL to provide that stability to the knee.
What is the difference between a ligament, a tendon, and a muscle? Are they all in the same family, or what
They're
is
all in the
difference?
same. Yeah, they're all in the same family. Ligaments connect bone to bone,
Okay.
and are made of type of collagen, as are tendons. But tendons connect muscle to bone,
Got it.
and muscle is its own separate category.
Okay, so the ACL, when you hear somebody have an ACL tear, it's pretty common.
Yeah.
Yes or no?
Yeah, ACL tears are becoming more and more common every year.
Why do you said in the opening that we're a lot more active. Why do you think it's more common? Because if we're more active, our body's moving more, there's more action going on.
Right.
What do you think that is?
Well, I think it's just more exposure to the types of movements that predict people for ACL injuries. So the more you're active in cutting or pivoting type activities, more chance you have of having an ACL tear. If you're sedentary and not moving much, you're not going to have that chance to tear your ACL.
But if you're sedentary and not moving much, can getting up and moving one way, that can happen too, right?
Sure.
Is it just because your body, it's the tendon, the ligament, like your body just doesn't move.
Right.
So it's not warmed up, and one sudden movement can just tear it.
That's true. Yeah, we do see that on occasion. Most times you're seeing ACL tears in people who are engaging in sports or the activities that put the knee at risk.
Happens to more men or women?
More women, actually. 2
Really?
to 4 times more likely to have an ACL tear for women than it is for men. Even though the nature of the injury and the cause of the injuries are the same, women seem to have this predilection to ACL injury.
Why do you think that is?
I think it's a combination of things. One, it's the angle of the knees
Okay.
is different in women than men. Women have a little bit more knock-knee alignment based on hip and pelvis anatomy. That puts you at risk. And then it's the mechanics of landing from a jump. Men tend to land more straight up and down, whereas women, because of that knee alignment, the knees tend to fold in a little bit, putting the ACL at risk.
And real quickly, could it also be because women wear high heels? I mean, could that be the way that it sets up the knee? Could that be a reason as well?
That's not been studied, but maybe it's something good to bring to the research committee.
Okay, then please, at your next meeting, and you bring that up, and if something happens and we win a Nobel,
Yeah.
I'll say it happened here on Healthline.
That's right.
More with Dr. Morgan and ACL signs and symptoms and what you need to know. Don't go away. Recent studies estimate that nearly 250,000 ACL injuries occur annually in the United States. The ACL is the most often stretched or torn or both by a sudden twisting motion when, for example, your feet are planted one way and your knees are turned another. Joining us from Adventist Health is Dr. Ryan Morgan, and his specialty is orthopedics. In regards to what I just said about, first of all, 250,000 just in the United States. And again, by sudden twisting motion, when your feet are planted one way and your knees are turned another. It can be that easy.
Yeah, we see it a lot of times in these non-contact injuries. 70% of ACLs tears happen in non-contact setting, meaning you're running, playing a sport, maybe you change direction, pivot on that knee suddenly, and you can sustain one of these injuries.
So a lot of what I read in regards to the statistics, it's not so much me sitting here and turning and twisting. It's more of being in an impact, like running, soccer, sprinting, stuff like that, football.
That's oftentimes when we're seeing it.
However, there could be somebody sitting here and they just turn, and that's because they're sedentary.
Right.
You're on a field, you tear your ACL. First of all, what happens? What is this feeling? What does someone need to know in regards to, I think I just tore my ACL?
Yeah. Most times people are going to hear or feel a pop in the knee. You feel something actually tear in the knee,
Okay.
and that's accompanied with pretty extreme pain. I mean,
And we're
you'll see-
talking right on top.
Right, yeah, right deep in the center of the knee. You'll feel that pop.
Okay, because then the meniscus is on the side.
Right, yeah, the meniscus
Okay.
you have on either side, so that's kind of a different area. Patients usually localize this to being kind of deep in the middle of the knee.
And anything over going through here from like the waist all the way down, that's your IT band.
Yep, IT band is that big band of tissue that runs along the side of the
Great.
leg. Does have some effect on the stability of the
Okay.
knee, certainly. But in the ACL, you're going to have to stop playing your sport.
Okay.
You know, once that tear happens, patients aren't able to get back and play that same game. The knee begins to swell almost immediately.
Okay.
And then typically patients are on crutches early on to help get around.
So in regards to the tear, can you have a partial tear and it recover? Or every time you have an ACL tear, do you have to have surgery?
No, not every ACL tear needs surgery. It's really more how the tear is affecting the stability of the knee,
Okay,
which we can test on a physical exam, but it's also the patient's experience of how their knee is doing in day-to-day activities. Patients will often feel a sense of like the knee's going to give out on them, or that they just don't
Okay.
trust the knee. If that's the situation in combination with an ACL tear, we're going to be leaning towards surgical treatment in that case.
and that's when you go to your doctor, and then, I'm on the field, I feel the pop, I go down in horrible pain. I'm afraid my knee's going to give out, I come see you. And if it's a partial tear without surgery, do you send me to physical therapy? Do we rehabilitate it? How do we heal?
Right, so if it's a partial tear and the knee stability is okay, patients are trusting their knee, we can certainly rehab that case. So go to physical therapy, working on strengthening not only the knee, but also the hip and core muscles, because they all provide dynamic stability to the knee and help protect the ACL.
And I love that you brought up the core, because a lot of people forget to use their core. We talk a lot about it here. Your core is right here. So even if a friend of mine just had a baby and she knocked out her back because she wasn't using her core to pick up her child, be really really have good intention with the way you pick up something, the way you move, and always engage your core. Somebody at the rehabilitation center, Justin Romeo, who's my physical therapist, always said engage your core as much as you remember, 15% every day, throughout the day,
Right.
just to keep it strong and engage it. I come see you and I have a full tear. What am I looking at?
So if there's a full ACL tear and you're somebody who wants to get back to being active in sports or activities that require an ACL, right, then we're going to be talking about surgery. Surgery is an outpatient surgery. That means you come in and leave the same day. It's about an hour and a half to 2 hour surgery, and we're making a new ACL. So we can't stitch it back together. We have to reconstruct it, making a new ACL.
Why can't you reconnect it?
When the ACL tears, the fibers are stretched out
Okay.
and damaged.
Okay.
And if you try to sew them together, it's like trying to sew tissue paper. So you can't sew it together. Also, because the ACL is in the center of the knee, it's surrounded by joint fluid,
Got it.
which prevents healing. So that's why we have to make a whole new ACL.
And what do you make the new ACL out of?
There's a few different options for that. Main categories are using a part from you or
Okay.
using a part from a donor.
So if I use the part from me, where would the part come from?
Options there are three main ones: either your patellar tendon, which is
Okay.
your kneecap tendon here, one of your hamstring tendons
Okay.
or part of your quadriceps tendon, which is just above the kneecap.
So you're basically repurposing my body from my body.
Yep.
Is there an issue, like if you use it for my patellar tendon, is there going to be a problem with that? Meaning, am I going to have future pain where you took the part?
Yeah, that's one of the downsides of using the patellar tendon,
Okay.
even though it's kind of the strongest and the gold standard as far as grafts go. There is about 10% of patients who have persistent pain on the front of their knee after that operation.
But bottom line is you're just repurposing. So it's great for my body to repurpose and heal it.
Right.
That's fantastic. More with Dr. Morgan when we come back. Don't go away. Welcome back. Adventist Health Glendale has been recognized by U.S. News & World Report as one of the best hospitals for 2018-2019, ranking 15 out of 130 hospitals right here in the Los Angeles area and 28 out of the 414 hospitals in California. Adventist Health Glendale recently received its 10th A grade in a row for patient safety from the Leapfrog Group. So to everyone at Adventist Health Glendale, congratulations. Keep up the great work. Joining us from Adventist Health Orthopedic Center is Dr. Ryan Morgan, and the conversation is all about the ACL. Dr. Morgan, we were talking about, you were sharing with us basically repurposing your body. Mm-hmm. And when somebody has an ACL surgical procedure, you basically repair their ACL with other parts. You said patellar tendon, the hamstring, and also the quads.
That's right.
I go through a procedure, we have surgery. Please share with everyone and myself how mandatory physical therapy is.
Yeah, physical therapy is really the key to your success after an ACL surgery. As a surgeon, I can do perfect surgery, but if you don't follow through with the rehabilitation, you're not going to have the outcome that you want. So following the physical therapy guidelines is critical. Physical therapy begins about a week after surgery and begins with basic range of motion and strengthening exercises for the knee, and then progresses from there. At about 3 months after surgery, patients are back to jogging. At 4 to 5 months, patients are back to doing some cutting drills, jumping, things like that. 6 months, we're starting to let patients get back into practice for their sport, but we don't let them get back to full-out gameplay for a minimum 9 months.
As I said to you earlier, I had shoulder surgery this summer, and I came in strong because I did a lot of prehabbing before my procedure. And most people, don't you find that most people, I've got to have surgery in a month. They just sit and do nothing for that month thinking they're going to have surgery. How important is it for someone to prehab themselves to build and make the surrounding areas stronger?
Yeah, I'm glad you brought that up because it really is important, especially in an ACL surgery, because you really need to have a strong, reliable quadriceps muscle or thigh muscle to get you back quicker to full out play or sport activity. The early rehab is all focused on getting that strength back. So the more that you can build up before surgery is going to speed up your recovery.
And it's also, in the very beginning of this, we talked a little bit about stretching. How important is just common stretching and just being warmed up before you do a real intense activity?
Yeah, you definitely want to make sure that you've stretched adequately and warmed up before participating in any sport activity. The reason being is that stretching helps to lengthen the muscles and tendons, and then warm up activates those muscles, because the muscles are really important for knee stability as well. It's not just the ligament alone. So making sure you're doing adequate stretching is very important as you get ready to play.
And also, a lot of people work a 9 to 5, an 8 to 6, a 7 to 7 job. And what is your invitation to them in regards to just stretching at their desk and at their office?
Yeah, I think some basic stretches you can do, at desk or on your own at home are very important. There's a few basic things that you can start with at home that may help protect your knee. And
it can be even as simple as you're sitting at your computer. First of all, when you're sitting at your desk, sit ergonomically, sit proper. This is horrible for your back. We've talked a lot about it, but even if you're at your desk, just even doing this with your legs.
Yeah, some calf raises there would be helpful. Some straight leg raises where you
Okay.
just keep the leg straight and really activate that quadriceps muscle can be helpful.
Do we extend? So, I love show and tell here.
Yeah, yeah.
So when so here, leg raises like this, but also just do that.
Yep, so that's going to help work those calf muscles, get the blood flowing. Doing those straight leg raises is going to
Love
work
that.
the quadricep muscle, which is really helpful for knee stability and alleviating pain.
And what's also great too is because, again, I've learned this from Adventist Health Physical Therapy Center, Justin Romeo, is even when you're sitting somewhere, do the alphabet with your ankle. It's
Yeah.
just keeping your body moving.
Right.
Doctor, what are your final thoughts in regards to having a healthy ACL?
Yeah, the thing with ACLs is that anybody can get an ACL tear at any time, especially if you're participating in high-risk sports like soccer or football, things where you're going to be pivoting and twisting. So you just want to make sure, like we discussed, stretching, strengthening, warm-up is all very, very important. The other nice thing that we're starting to offer, and there's been more and more research on this, is ACL prevention programs. And so we have one of those at Glendale Adventist at the physical therapy department, where we're working on mechanics of running,
Love that.
jumping, landing appropriately, so you're not putting your ACL at risk. And so these programs are good for not only patients who have had surgery, who want to reduce their risk of re-injury, but also because we know a third of people who tear one are likely to tear the other. This can prevent injury to the other knee by going through these ACL prevention programs.
Because what we were talking about earlier too is like when you're at the gym and you see people doing forward lunges or backward lunges or jumping like box jumps. It's not that they're doing the jump wrong, they're landing wrong. They're landing too forward or too back. And so what you guys share at the recovery center, at the PT center, is how to do it correctly.
That's right.
Because a lot of people get injured just because they don't even walk right.
Right. Yeah, it's a lot to do with mechanics and alignment of the joint, and also muscle fatigue, which can put the joint at risk.
Doctor, thank you so much. Will you come back and visit us?
Sure. Yeah, happy to.
Dr. Morgan, thank you so much.
you.
Okay, so you heard it from Dr. Morgan. Just stretch. Warm up before you work out. Pay attention. Our mission here, as you know, is to give you as much as we can about living a happy, healthy lifestyle. You can always find us on social media, Facebook at AH Glendale, LinkedIn, Adventist Health. And for more information, please visit the website, adventisthealthglendale.org. And you can always find me at Gregory Zarian. The most important conversation you're going to have is about you and your health. So why not start the conversation now? We'll see you next time. Take care.